for prostate cancer, when I start to talk to patients about different treatment options, I sort of break it up into what stage they're in or what grade group they're in is how we talk about it these days. And it really depends on what their cancer is and what it looks like. So for early stage cancers, there are several different options. We sometimes talk to patients about surgery or radiation, but one option that I often talk to patients about is called active surveillance. So when a patient does get screened and they are found to have a prostate cancer, they go through a process where they usually will check the PSA and then they'll get a biopsy done after that. And the biopsy shows cancer. And if it's a lower risk type of cancer, one of the options is something called active surveillance. Now, getting back to this screening phenomenon, what we would really like out of a screening test is something that helps us find the cancers that will benefit from treatment. Yeah. And in many ways, that's sort of the downfall of the PSA, because it doesn't always tell us, is this patient going to benefit from radiation or surgery, which are the two major options for prostate cancer. And so we sort of have a surrogate for that, in that we can follow the PSA, we can do MRI scans, we can do further digital rectal exams, we can do further biopsies. And if the cancer begins to look more aggressive, then we start to recommend those treatments of surgery or radiation. So as it progresses down the line, that's where we really get into the point where we make a decision. And for intermediate stage cancers, surgery is one of the options, radiation is one of the options. Sometimes we add in things like hormone blockers. For more advanced cancers, I generally recommend radiation with the hormone blockers. And for the most advanced cases where the cancer's already metastasized to other places in the body, I generally recommend hormone blockers, possibly with directed radiation treatment, chemotherapy, or other immunotherapies or other directed treatments. These treatments have been being developed over many years, and we're still trying to find new treatments that will help our patients even more.